A life cut short. The tragedy of Nevaeh Crain. Nevaeh Crain was a young woman with dreams. At 18, she was excited to become a mother. She lived in Texas, a state grappling with some of the strictest abortion laws in the country. Tragically, Nevaeh's life was cut short in October 2023. She was 6 months pregnant. Her death, following multiple trips to the ER for agonizing abdominal pain, sent shockwaves across the nation. It raised a chilling question. Did restrictive abortion laws contribute to her untimely demise? Nevaeh's case isn't just a local tragedy, it's a national wake-up call. It exposes the potential consequences of laws designed to restrict access to abortion, even when a woman's life hangs in the balance. Her story is a stark reminder that behind the political rhetoric are real women facing real medical crises, and sometimes the system fails them. A system in crisis. How restrictive laws failed Nevaeh. Nevaeh's ordeal began with excruciating abdominal pain. She sought help at the ER not once but multiple times. Each visit followed a similar pattern: agonizing pain, pleas for help, and ultimately discharge from the hospital with little more than pain medication. Why was a young woman clearly in distress repeatedly turned away? The answer may lie in the complex and often terrifying legal landscape for healthcare providers in Texas. After the Supreme Court overturned Roe v. Wade, Texas enacted SB 8, one of the most restrictive abortion laws in the country. This law bans abortions after 6 weeks, with few exceptions. It also allows private citizens to sue anyone who aids or abets an abortion, creating a climate of fear and uncertainty. Doctors facing potential lawsuits and even jail time are forced to navigate a legal minefield. In Nevaeh's case, did this fear of legal repercussions lead to hesitation, to delays in critical care that ultimately proved fatal? A chilling effect, the fear gripping healthcare providers. The chilling effect of restrictive abortion laws is undeniable. Doctors, bound by an oath to do no harm, are increasingly caught between their medical judgment and the fear of legal ramifications. The consequences of this fear are profound. Delays in care, misdiagnosis, and in some cases outright refusal to provide necessary medical services have become a terrifying reality for women in states like Texas. The Texas Alliance for Life, TAL, a prominent anti-abortion group, argues that Texas law permits abortions to save a woman's life. They point to data indicating that abortions have been performed under these exceptions since the Dobbs ruling, but reproductive rights advocates counter that the law's exceptions are vague and open to interpretation, leaving doctors vulnerable to lawsuits. This creates a chilling effect where doctors prioritize avoiding legal trouble over providing the best possible care for their patients. Section 4. A nation divided, the battle over abortion rights. Nevaeh's story isn't just about one woman or one state. It reflects a nation deeply divided on the issue of abortion. The debate is often framed as a battle between two unwavering sides: those who believe in a woman's right to choose and those who believe in the sanctity of life from conception. On one side are those who argue that abortion is a fundamental right, essential for women's bodily autonomy and reproductive freedom. They believe that women should have the right to make decisions about their own bodies and their own healthcare without interference from the government. On the other side are those who believe that abortion is morally wrong, tantamount to murder. They argue that the unborn child deserves legal protection and that abortion should be illegal in all or most cases. Section 5. A matter of life and death, the stakes for women's health. The debate over abortion rights isn't just theoretical. It has real-world consequences for women's health and well-being. Restrictive abortion laws, like those in Texas, create a climate of fear and uncertainty, not just for women, but for healthcare providers as well. This fear can have devastating consequences, delaying or preventing women from receiving the care they need when they need it most. Access to comprehensive reproductive health care, including abortion care, is essential for women's health and equality. When women are denied access to safe and legal abortion, they are forced to carry unwanted pregnancies to term, putting their health and lives at risk. They may also be forced to seek out unsafe abortion methods, which can result in serious complications and even death. Section 6. A call to action ensuring access to quality care for all. Nevaeh Crain's tragic death serves as a stark reminder of the human cost of restrictive abortion laws. Her story is a call to action, A plea to prioritize women's health and well-being in the ongoing debate over abortion rights. We cannot stand idly by as women's lives are put at risk. We must demand better from our elected officials, from our healthcare system, and from ourselves. We must fight for a future where all women have access to safe, legal, and affordable abortion care, regardless of where they live or how much money they make. We must challenge the stigma surrounding abortion and ensure that women feel supported in making the best decisions for their own bodies and their own lives. And we must never forget Nevaeh Crain, whose story serves as a tragic reminder of what's at stake.